The new generation of neuroangiography suites, and I would prefer calling them the stroke unit or the stroke angiography suite, is tailored and manufactured in a fashion that we can assess certain parts of the brain in a patient that experiences stroke and provide all the information needed on the imaging side and then proceed on the same system or angiography suite with the treatment. So the proposition is to harbor this stroke unit inside the emergency department so the patient can, from home with the ambulance, be shipped directly into the stroke system. And the imaging that's so important of the brain to rule out whether there's a bleed inside the brain or an ischemic stroke, which is resulting from a blockage of the artery, can be differentiated. So once we have the image, we want then to know whether there's enough blood supply to the area that's at risk for stroke. We call it collateral blood supply, as well as define the area of the occlusion within the artery. And that all can be accomplished on the same system, on the same angiography system, where we then proceed with the intervention. That means with removal of the clot, which is called thrombectomy and thromboaspiration. So what we are doing is we're designing a room which is dedicated for the management of a stroke patient. The room harbors a system which is made out of a C-arm, like the conventional angiography system, and a flat panel detector, which is very similarly constructed like a CT scanner. So what the system does, it rotates around the head of the patient and obtains all the information that's required before we proceed with the treatment. In the room, of course, there are access to anesthesia in case we need the presence of anesthesiology. In the room, there's an access and a workstation for the nursing staff, as well as all the devices and the tool that are overseen by X-ray technologies. So you have three components in addition to the angiography suite that is located within the stroke unit. So you will have the anesthesiologist and his team, you have the nursing team, and you have the X-ray technology team, which supports the physician that does the procedure itself. The major difference between the conventional and the new stroke unit or stroke angiography suite is that we are bypassing the diagnostic imaging on the regular conventional CT scanner, which are called also the multi-detector CT scanners. So we can obtain again the information on the brain tissue, whether there is a bleed or there is no bleed. We can obtain the information that there is enough blood supply to the areas that are going to die if we don't open up the artery. We can define the blockage, where exactly the blockage is, and also how long the blockage is, how long the clot is. All that information can be obtained from this flat panel detector. More than that, this enables us also then to insert the tools inside the brain and remove the clot. So this is the idea of what we call the one-stop shop. Instead of what we do right now is we take the patient from the emergency department to the conventional multi-detector CT scanner, do the imaging of the brain, then we take the patients from the CT scanner on a stretcher to the angiography suite for treatment. What we are trying to do is we are trying to save time and costs to the system and bring all the two components within one space.